Dr. Ghecemy Lopez is a Latinx immigrant, language educator, social impact innovator, and a committed bilingual advocate for health equity and cancer research. Dr. Lopez works as a program administrator of cancer navigation, survivorship, and advocacy at Cedars-Sinai Cancer Community Outreach and Engagement Team, leading several community-based projects that can improve access and quality of life for patients and their loved ones, and promoting bidirectional research between patients, community, and scientists. In addition to that, she is also known as a global cancer research advocate. She reviews research protocols, chairs committees, and collaborates with multiple scientists, clinicians, and fellow survivor advocates, government entities, small and large nonprofits within the state of California, nationally, and abroad. Dr. Lopez survived breast and thyroid cancer in her early 30s. Since then, her mission became making the road a bit easier for underrepresented cancer groups, especially those who experience cultural and linguistic barriers. Dr. Lopez holds a bachelor's degree in English and teaching foreign languages, a master's in adult education and training, and a doctor of social work degree from USC. Please welcome my good friend and colleague, Dr. Lopez.
Thank you, Mayra. I'm Mayra's fan, by the way. Well, thank you so much for the invitation, and it's my pleasure to speak with you about my main mission, which is helping close the health gap for our community, especially for the immigrant communities uh, in that are affected by cancer. Um, as Myra said, I work directly in cancer navigation, cancer survivorship, advocacy within Cedars-Sinai Community Outreach and Engagement Team. And today I am here to help bring some of that information. The first thing I would like to have as an objective is to help define the population that we're going to be discussing today and the unique characteristics of it. So we are going to focus on the immigrant community and special considerations that need to be mentioned before we start this. The next objective will be to discuss a little bit of the social and psychosocial aspects because they really play a key role in impacting the survival and the long-term survivorship of our patients. We need to understand the intersectionality and their needs, social determinants of health and their needs, as well as the different trauma and violence that our community has endured and how we can be more sensitive to those members who have experienced that. And then to finalize, I will be speaking about some potential solutions to close the health gap in general. We're going to discuss why closing the health gap matters, examples of evidence-based models and resources that you can use to adapt and use in your work, and recommendations and opportunities. So if we jump right here, the immigrant community, we hear a lot about immigrants in the media, especially, but also in our daily interactions. And I think the first thing we need to do is define that immigrant is someone who was born outside the United States and now is residing here, regardless of what their immigration status is. So that means we're going to have people who misuse the word immigrant when they are referring to perhaps undocumented immigrant, or they could be referring to a documented immigrant. An undocumented immigrant is a person who resides in the country but doesn't have federal documentation that authorizes them to live, work, and even enter the country. For the experience that we have working in underserved communities, I can tell you that the great majority of the patients and caregivers that I have served over the last 12 years identify themselves either as either one of the above, and about 62% of them were monolingual in another language. So this is pretty significant because as we are experiencing the constant migrations that are happening, mass migrations in the world, we are going to be seeing more of these immigrant communities coming and asking for help from us in the healthcare field. So it's very important that we understand why we need to be prepared and what we need to do about that. So some special considerations that I would like to say is, as I mentioned before, not all immigrants are the same. Do not refer to anyone as an illegal person because the proper term is undocumented. That's something that uh, we, as we, learn more about this, especially the effects, the social effects that the word illegal can impact on a person's life. It's very important that we don't become part of the problem by misusing the proper term. Undocumented people who enter in the country as minors and meet certain eligibility requirements are also called dreamers. And you may hear about them in the news a lot, especially because DACA recipients continue to be in the news because of the Supreme Court decision and mandate. So unfortunately, this is a very gray area in the immigration system in our country that is still pending to be solved. Sometimes immigrant families raise their children with limited to no knowledge of their language of origin. And this is something that especially happened around the 80s, even more than now. And that's because people were experiencing so much xenophobia that it was a way to protect their children and grandchildren by not teaching them the language. Uh, Fortunately, lately, that is more acceptable, that people obviously actually encourage families to teach their children um, their native language in addition to English language. And that's because it will help them in many different ways, especially if we think about the individual's eventual job opportunities and economic advancement. In Los Angeles, for example, we have the largest number of Korean-born people living outside Korea. Los Angeles is also known for having the largest number of Mexican-born people living outside of Mexico, and the largest number of Salvadoran-born people living outside El Salvador, and also for Filipino-born communities living outside the Philippines. So this is something that uh, we rarely hear, but it's important because it really matters when you think about developing and adapting our medical system so that we are not ignoring this information. And just also another thing that is important to mention, we have about 156 languages spoken in Los Angeles in the households, even if they are not spoken in the street, but there are many people who are monolingual and they speak or bilingual, but they speak in their native language in the household. And in the United States, another thing that is important to know is that California, as you know, is considered a sanctuary state. And this actually is good and is bad for the immigrant community in many ways. Right now, the proposed requirements might lock out of coverage for people, most of the individuals that would likely need cancer screenings or preventive services. So in general, California is very generous with their Medicaid, or in this case, Medical, but we still have to continuously see changes, especially in coverage age. And fortunately, within the last few months, we have now been able to offer healthcare for people who are older than their 50s. And that is very helpful for those who are not able to participate with documents in the general work. And one last thing. Okay, by 2050, it's projected that approximately 1 out of every 3 Latinx community members will be diagnosed with cancer. So yes, although I did mention that there are several other major immigrant groups in Los Angeles, by far the Latinx community is the largest, and the fact that projected this is projected American Cancer Society is concerned that we're not ready to not only to be able to serve our Latinx community members, but we also have the hope, at least as a s- as a survivor of cancer, I have the hope that people change the way that they live their lifestyle, and do as much as possible to reduce their cancer risk, so they don't become part of this statistic, and hopefully we don't get to see this statistic become a reality. Another important note to consider is that, and we will talk about the intersectionality shortly, but more than 1/3 of LGBTQ plus cancer survivors have experienced discrimination in healthcare setting. So this definitely impacts the care, and even that they stay in treatment, because obviously if a person feels discriminated, uh, person will not continue their treatment, and especially if it's cancer, we need to make sure that the person stays during the entire treatment. Um, this happens also when there have been discriminations of language, and we want to eradicate that as well. That's part of the health gap. So I will focus right now on the social and psychological aspects of this, and why we need to consider them as they impact our cancer patients, but also their caregivers. Um, we discuss about intersectionality. So intersectionality is important. It's an important concept because in our immigrant community, we will have people not only who are Black, Indigenous, and people of color like BIPOC or LGBTQ plus. We might have a patient who might also be of AYA need, like adolescent and young adult with cancer need, or we might have elderly people who need that care. We also have people who speak different language. They are monolingual in another language. So we have all these multiple intersectionalities within themselves that we want to make sure that in the same way that we are promoting precision oncology, precision medicine, we also need to promote what would be the precision support, if you want to call it like that. Precision support, where we are targeting the social services available that are embracing all their multiple hats or labels. I I think that that's important that we are able to prepare ourselves for that. Um, so, as some of you are very familiar with, social determinants of health play also a key role with our community. It really depends on how many social determinants of health the person is experiencing, in addition to cancer, in addition to the disease. So when we when we learn of a new patient, that a newly diagnosed person that is also struggling with housing, uh, like I mentioned before, the language barrier or cultural barrier, or maybe this person is also facing a financial challenge. All these social determinants of health can really determine if the person is going to have better chances of surviving cancer or not. And unfortunately, the fact that people who come from low socioeconomic status, when they come to find out their diagnosis, they usually get diagnosed at later stage. So that is a major um, uh, storm, because you have to not only deal with someone who has very advanced aggressive cancer, but also very difficult or complex socioeconomic situation. And uh, what and we will talk about that when I discuss potential solutions. but these are things that we need to consider. The World Health Organization has really made a big push for healthcare providers to focus on social determinants of health for that reason. And as I mentioned in the beginning, because of our current geopolitical situation in the world, the wars, the climate change, and all these things that are affecting the livelihood of people and make them move from one country to another, we really need to be prepared because those social determinants of health are going to be getting more complicated within the next couple of years. I did mention also the importance of being mindful of people's trauma and violent past. Unfortunately, this is something that has been well studied. Something like mental illness can really affect the person's uh, wellness in general during treatment, especially. We have had to help patients who have a struggle with severe mental illness conditions in addition to cancer, and that has been challenging to make them stick to treatment sometimes because of their mental condition. So it's important that they don't stop their treatment for mental health during the time of their cancer care. We also many times have to help our patients who are struggling with domestic violence, especially because the gender violence, not only for binary but also non-binary community members, it's very prevalent. And unfortunately, because of that, it's difficult for them to have a safe environment at home where they can recover or go through their treatment. The other thing is to keep in mind the immigration related stress. And even though there have been studies that mention obviously immigrants have a higher risk of developing certain cancers such as breast cancer, it's important to keep in mind that it doesn't matter how long ago the the person immigrated in this country, because the effect could be a long-lasting effect for several years, and they would still feel one way of stress. One of the stress that is obvious is the the moment when they immigrate out of their comfort place into a new place that is full of strangers, but also the fact that many people, especially undocumented people, have to struggle with really difficult immigration process, and this is a constant stress. And as we know, stress is really not like not the best friend for cancer development, and the microenvironment of cancer is really not good. So we want to keep that under consideration. Um, Another very well studied topic is the adverse childhood events, or ACE. It was also in the literature that there have been, like I mentioned before, people who have the 3 times the likelihood of developing cancer or certain types of cancer if they had experienced early childhood trauma. And then, speaking of trauma, we have complex trauma, um, and it's also um, regular trauma and complex trauma. So, for those of you who are not very familiar with this, you could experience trauma in a direct way, on a single location or multiple locations. When the person has experienced trauma, especially for the patients that I have navigated, uh, we consider complex trauma if a person has experienced at least 4 different types of trauma or more in their lifetime. And especially when all of this happen around the early childhood years, it's even more difficult for the person to be able to cope with the stress, but to cope also with the diagnosis and to struggle more during survivorship years. So complex trauma is definitely something we need to address, and it's not going to be a one-time solution. So we need to um, reinforce this information that people are still able to cope with that if they receive the proper support. And addictions is another issue that is very common in our immigrant community, and unfortunately that can also affect severely the outcomes of cancer survivorship. We have for example, one of the things that at CSCLA right now we're working on is tobacco control, because as you know, it's one of those tobacco is for sure has been proven that it could cause lung cancer, and because of that, it's important that we try to do preventative measures, especially with our young adults. And also, it's very prevalent in our LGBTQ plus community. When we speak about addictions, we also need to consider the vaping that is very popular in our youth, and how that can also trigger the early onset of cancer, like early development of cancer in young adults. But also, it's very difficult to work to have a good prognosis in when the person is experiencing an addiction, and they also, for example, people who are addicted to certain opioids, they have a very difficult time um, adapting to getting opioids for other reasons, because if you are dealing with a cancer diagnosis that gives you a lot of pain, but you also had this prior addiction, then it really is difficult for the doctors to offer that as an alternative for you, because then you could trigger one or the other. And unfortunately, there are many things to consider in this aspect, and that's why sometimes people get denied certain painkilling medications. So this is definitely very important to consider. And the other thing that we learned, especially became more popular in research during the COVID-19 pandemic, we all learned about the danger of social isolation. And as immigrant communities, when they come to this country, many times they come by themselves. They don't have their circle of support, their family members or immediate family is usually in another country. So they have to figure things on their own for a while. And this is even more difficult when the person has to uh, face cancer and still have to have a limited social support, um, regardless of their age. It's still difficult. Sometimes people would think that young adults don't suffer social isolation, that this is more of an elderly person situation, but it's actually affecting people of all ages. So it's very troublesome, and we need to think how to address that, how to close that gap. So let's try to think switch gear to some potential solutions. Um, as you know, we have some examples of evidence-based models and resources that health professionals like yourself could use. Some of you might be working in patient navigation, so you might be familiar with patient navigation model. And in this patient navigation model, as you know, patient navigation has different types of navigation. So for example, there are the professional navigation, like nurse navigation type, or social work navigation, but you also are now including in our healthcare system the collaboration with health promoters or community health workers, who are lay navigators who work in the community, and they are key people in their community, trusted members of the community. So this is something we can use for our advantage to develop these systems of support for our patients and models for program services that include different types of patient navigators at the same time. Another thing was the human-centered design model, where, as the name mentions, it's very similar to in healthcare, we use the patient-centered care model. And the human-centered design model is to analyze all the aspects of an individual and to be able to design projects or programs that are going to address every different aspect of the human being. So that's something to also consider. Then we have the design thinking model. And this one is one of my favorites because with the design thinking model, you actually are doing like a wild brainstorming where in the very beginning you think about what problems are happening, and then you start targeting with the wildest ideas how you would solve that problem. The way I can explain this is like, how would you solve the problem if you had all the resources in the world and all the money in the world available for you? And then after you start throwing these ideas where creativity is coming out of your brain and there is no limitation, that's when you start like, okay, now out of these crazy ideas, what can we do to narrow it down, to have for example, empathy, analysis, and all the aspects that are going to be important as we design our projects and programs. Oh, sorry. The ecological systems theory will also be helpful because we need to consider the patients and caregivers not only for the problems that they are confronting in the micro level of work, but also we look at the macro level of the system. So what are those environments in which they are living, working, or praying, right? Because many of our immigrant communities rely a lot on their faith-based communities. So this is something that we could also consider. What are those ecological systems around the patient and the caregivers, and how we can make the best out of them? And then I included the reciprocal engagement model, and this is something that is actually more commonly used with the genetic counselors. I have a lot of respect for all the genetic counselors that I've met throughout my career, because they empathize with our immigrant community in a different way. They are very mindful in the way that we present a situation to the patient, and we try to use this model to create rapport in a way that the person doesn't feel attacked and is able to trust the provider since the very beginning. So it's a very good engagement model that I would recommend for those of you who are health providers. Uh, like I mentioned, genetic counselors use this a lot. So most likely, if you are a genetic counselor, you're very familiar with it. But I think this is something we could also take some of that information to use in our common practice. And I want to continue talking about like resources, recommendations, and opportunities. So for example, if we're thinking of macro level change that we want to see for our immigrant cancer patients, we want to continue working with legislators that are not xenophobic and that we can work with them in proposing bills, but also passing those bills, especially to continue supporting timely healthcare access, not only for treatment care, but also diagnostic screening. The timely manner in which these type of services are offered for our immigrant community really matters, because if we look at the whole economic impact of cancer in our society, it would really help uh, the economic situation if we are able to address a problem, if you look at it from the legislative perspective. But if you look at it from the patient-centered perspective, I mean, it will really facilitate that the person is treated promptly and hopefully still in early stage cancer, or that if it's a late stage cancer situation or aggressive cancer, that the person receives everything they need, regardless of their immigration status. Um, and like the sign says, yeah, healthcare is a basic human right, and it's the right thing to do. So every time that I have faced challenges as an advocate, when I'm trying to uh, partner with organizations and we're trying to push the agenda of supporting, for example, um, the healthcare reform and things like that nature, and we find legislators who are not willing to support that, I always think about this as advocacy is a non-partisan endeavor. So we're not trying to do this because we belong to a political party or another. We're doing this because it's the ethical thing to do as human beings, and that's how we can push this forward. The other thing I proposed was encourage and support patients and caregivers to participate in cancer advocacy. I think that especially within the last few years, people are a little bit more open to learn about cancer research, although we still struggle because the disparities show, especially the disparities in people of color, show that we still don't have enough participants, especially BIPOC and LGBTQ plus participants in research and clinical trials, and therefore when the new treatment, drugs, or technologies come about, that doesn't necessarily mean that it's going to apply to all of us who have ethnic or differences or gender differences. So it's very important to participate, and I would really make this as a call of action for all of you who are my colleagues, whether you work in a cancer organization, on healthcare or healthcare industry, to support your patients. Cancer advocacy can happen in different ways. As you know, it could be in lobbying, as I mentioned earlier. It could also mean participating in research committees, re reviewing protocols, and participating actively in the design and implementation of research and clinical trials. So more likely, if you reach out to any major research institution in Los Angeles, we have a few NCI designated cancer research centers, as well as organizations who are working in cancer research, that would be very happy to hear from you, from your interest, or from if you want to learn more about how to get engaged or how to get your patients engaged. And another way that is now important to mention, that cancer survivors who used to be called cancer research advocates now are more known as community scientists, because we're trying to make that bridge between the community and the scientific world. Another proposal I have to close the health gap is to create resource materials, digital content, and social support services. During the pandemic, we also learned that in order for us to continue providing services to our communities, we had to use online capacity for like digital platforms, webinars, everything that came about. But it's not just to develop a webinar or to create a digital brochure. It has to be sensitive. And in order for that brochure or that webinar to be culturally and linguistically tailored, you need to include underrepresented groups since the design and since the brainstorming part of that. So once again, this is an invitation for our immigrant community, patients and caregivers, and even just the community at large. You bring a perspective that no other person has, and scientists and health providers need you. Other suggestions that I have here is that for us to close the health gap, we must wear our critical thinking and culturally sensitive hats at all times. We have to be mindful of social norms. I think that as social workers, we are very familiar with this, where uh, social norms are what has been established for years, and people, uh, it's kind of like the hidden message that everybody knows, but nobody really accepts. But there are times where these social norms work against our immigrant community. So we want to dispel all these myths and taboos about it. We also need to learn about the faith system or faith belief system of people. We need to also understand what their ethics are and cultural cues. Remember that because we are coming from very different geographical locations and very different cultural upbringings, we cannot assume that we all understand ethics or faith or beliefs or social norms in the same way as our immigrant community patients and caregivers. Another thing is I really encourage everybody to take further trainings on any of the topics that have been discussed in this Health Equity Summit. I think that part of our professional development is to always keep up to date with the latest. But I think this is more than just professional development learning. I think this is more personal growth, for personal growth. So take further trainings. It will help you to help us close the health gap. I also would like to encourage foster cultural humility, and maybe one of those trainings you can take is about trauma violence or trauma informed care or violence informed care in your community, and how you can apply that in your clinic or your community organization. Uh, Am I good with time? Did I pass too much? I still have time. um, and then if I can also mention that we have to do some self introspection to analyze if what we are currently offering for immigrant community cancer patients is really the standard of care, or we are doing this from a compassionate care. So it's very important because many times we get so into the daily routine, especially in healthcare or in the cancer communities, that sometimes we lose track of what is important. And one thing I really appreciate from one of my mentors is that she told me that I asked her one time, what is one advice you can give me about how to know if I am still in the right place at the right time, right? And she told me the day you wake up in the morning and you feel that you are no longer going to make a difference and you feel that you're dreading to go to work, especially if you're going to be doing this kind of work, that means that you're just providing the average, the very minimum standard of care. If you are still excited in the morning to wake up and go to work, more than likely you're going to still be providing compassionate care, because you're going to be looking at that person as a whole, but you will also look into that person's soul and that person's connection as a human being. So we have to analyze ourselves from time to time. We have to leverage existing resources and partners with multidisciplinary expertise. I have friends in the cancer community that are always interested in meeting and networking people from multiple disciplines. And this is something you can do. Everybody has to, you don't know when you're going to be needing, for example, biomedical engineer to give a presentation in your hospital, right? Or in your cancer organization. You don't think about bringing a musician to one of your cancer community support groups. We have to think outside the box, and we also have to think beyond just the typical health professions. We also need to prepare and include your needs in the next fiscal year budget. I think that many times we have all these great ideas, but if we don't plan ahead and we don't try to make a point to include it in next year's fiscal budget, I think that it's not going to happen. So we need to have a really do your homework, and with due diligence, you'll be able to accommodate that and make it happen. And host regular community forums to learn from the community. The community are the experts, so we need to know what is happening. We need to learn from them because communities evolve, and the needs of the communities evolve too. And last but not least, I put educate our immigrant community about the US health system, but we also need to learn what their health system look like in their countries, so we can understand why, for example, it's very challenging for certain cultures to speak up to their doctor about a question they may have. We also need to give them financial education, and we also need to introduce the concept of preventive medicine, because one of the things that I've learned with my immigrant patients is that they not always understand the concept of preventive medicine. They usually go to the doctor when they are already sick, and we need to help them understand that preventive medicine can really save their life. Create and or partner with others about clinical trials engagement, and that's something I mentioned earlier. So there are many of us in the healthcare field who will be very excited to discuss with you about how to partner for clinical trials engagement. So that's it. I just want to leave you with a reflection of why does closing the health gap matters to you, and why does it matter now? I think that if you could do this as a homework for yourself, closing the health gap matters to me because you can answer that question later. And the vulnerable population group that I advocate for is, right? We need to know what exactly, if you work with groups, underrepresented groups who also have intersectionalities, this is something we need to write down. Remember, if you don't write things down, it's not going to stay in your mind. And then from the ideas presented today, the type of opportunity that I could possibly pursue first is. So I hope that some of the ideas that I propose are helpful for your work, and together we can close the health gap. Thank you.
Thank you so much, Dr. Lopez, for that wonderful insight into our immigrant communities. And I'm going to start off with a personal question. And I know you brought this up at the beginning and towards the end as well. And first of all, thank you for the language lesson, right? And I am constantly telling folks, no human being is illegal, right? And so the proper terminology is to say undocumented immigrant. So I do appreciate you bringing that up at the beginning of the presentation. But we talked a little bit about, access to care. And in California, we have expanded Medi-Cal to cover undocumented immigrants over 50, and you did mention that. And then starting in 2024, we're going to cover undocumented immigrants over 26, right? Because children are already covered. Yeah. But and this is personal because I work in a managed care organization. What do you suggest that we can do to reduce that misconception that enrolling in and utilizing Medi-Cal is considered a public charge, right? Because there's that misinformation out there that folks say, I don't want to sign up because I don't want it to affect my citizenship pathway. So what is it that we can do to kind of address that misconception and make sure that they're using their Medi-Cal and using those preventive services?
Thank you. That's an excellent question, because similar to what I had mentioned earlier about the reciprocal engagement model that the genetic counselors use, it's a something you might I can probably write it on the chat, but something to look into. I think that we need to connect with people and establish that trust since the very beginning, to make them see that we as health professionals or health providers, we are here for the mission of saving lives, for the mission of support, and we are not here to enforce immigration laws. We're not here to take people to prison or anything like that. Um, if we are really in this healthcare field, is because we have a commitment to be compassionate to others. So if we are able to establish that since the very beginning, I will give you an example. When I was working with patient navigation, I remember that there was a time when a police officer had passed away in the hospital where I was working. And unfortunately, there was no way to know for people. Only some of us knew that's what was happening. So there was a lot of police presence outside the hospital. And we were having an event that day with the general community members. Some community members later told me that they were terrified when they were arriving to our event because they saw police cars outside. And just because of that, they immediately thought of immigration. It wasn't even related, but I can I felt responsible as a health professional that we could have done better in informing them ahead that there could be a potential police presence, but has nothing to do with patients or activities that we were planning. So those are the type of things when we have to try to wear the same shoes. I know it's very difficult and different for everybody, but if we are trying to at least do a better job, we need to think 2 steps ahead so people can feel comfortable.
Yeah, and also, I'm going to give a little call to action to everyone here that to bring awareness to that availability now, because we always attributed some of those health disparities in the immigrant community to lack of access to care. And we know it doesn't solve all the problems, that it's multifactorial, but more people need to know that now Medi-Cal covers undocumented immigrants,
Yes.
over 50 currently, and in 2024 it's going to be of all ages, to make sure that at least we cover that one little section where people
Is
can have access.
to use the word of mouth, which is so powerful in our immigrant community. The word
Yes,
of mouth.
la comadre, right?
La comadre, la
Yeah,
conversations everywhere.
those trusty sources of information.
Yes.
Now, my next question for you then is, you brought up the social determinants of health, right? So what are some successful strategies for addressing the social determinants of health, like housing, employment, and transportation, which can really have a significant impact on the health of immigrant populations affected by cancer?
So we have to partner with multiple organizations that address all those different social determinants of health. I remember a case where I was trying to help a patient that had just been diagnosed with a specific type of cancer, uh, and the fact that he was also being evicted from his home. Um, I had to suggest that we need to partner internally and externally. Internally, because you partner with the medical oncologist and say, I understand that this is happening, but in my role offering the social support, I will make sure that my patient is well taken care of on that social determinant of health aspect, while you take care of the biological aspect. So we can do that collaboration internally. Uh, and in this case, I remember telling even there was a researcher involved because this person was eligible for a clinical trial. I say, this is very important that the person comes back, but at the same time, while you're doing that, we're going to be helping him connect with this community organization that helps people identify housing. So that way it's like all at once.
Yeah, that's a great idea. And then, I know one of the strategies is having, like you mentioned, compassionate providers like yourself, and like the presenters we had today. I still remember all the stories you told me, like even of helping, patients get mattresses, right? And whatever, meeting those needs. And it does take a compassionate care force to kind of address some of those, because not everything might not be covered by insurance, or there's so many different barriers, and caring for that whole person
Yeah,
involves addressing all of these things too, right? I like to say
yeah.
that I know you are a social worker, definitely a doctor of social work. I say I've become, as a public health professional, a default social worker, because I had to learn about immigration law, and I had to learn about utility payments and housing,
Yes,
because I couldn't work with the patient and not address all of those things first,
exactly.
right?
We cannot ignore what is in front of us.
Exactly.
And
Yeah.
what you mentioned, it really reminded me another situation that actually is very common in our immigrant community. Sometimes they have to leave, they have to abandon their apartment or their cars, right, where they live. And if they have to do that, they have to go find resources right away. But they're also dealing with cancer. It's like we need to be always 2 steps ahead of them, just in
Yeah,
case they need us.
exactly. So I'm going to move on to a question that came in. And so you covered a lot of different models and theories on, how to address some of those disparities. The question is, what model have you found to be most successful when solving some of those complex problems?
I think maybe because of the experience that I've had, I used a lot of the human design center model, and in a combination with patient navigation. But lately, I discovered the benefit of the eco-social theory, ecological social theory, because you have to, we have to start from the micro to the macro. So if we are able to combine like an eclectic model, a little bit of everything, it will be helpful. But obviously by training, I think the patient navigation model has been like the most important for me, in addition with the human design center model.
Thank you. Another question that came in is, how do you define cultural humility?
Very good question. Um, I think that when we introduce ourselves to someone, uh, even could be someone from my same ethnic background, I cannot make the assumption that I know that person. And that even happened with my husband is from my same ethnic background. We're Latinos. But just the fact that he's from Argentina and from Mexico, we have so many different cultural variations, I would say. So I had to be humble that when I meet someone new, especially from the patients or the caregivers, that even if I had already met someone from their same background, is going to be a completely new story. And to be open-minded that I'm gonna be learning, because maybe yes, they are from that same ethnic background, but they have a different family culture. So that's another thing that it's important to consider. Every family has a different culture in itself. So just that, being open.
Absolutely right. Just being open and knowing that, you don't know everything, and just being open to learning, and that
Yes.
humility, right? That
And
you
part
won't
of
always
the
get it right.
part of the humility is also accept when you make a mistake. I think we have to be humble about that too, because many times I make mistakes, and I have to say, I'm sorry, I made a mistake. You have to admit it. And I
Yes,
think that that's what also brings you closer to a person, when they can see that you are on the same level as them. You are not trying to be higher, or behind or something.
exactly. Thank you so much. Now, the next question is, what type of legislation has been most helpful for immigrant communities?
Well, I think in California we have been very blessed with our legislation. Honestly, I've have I have had the opportunity to help or connect with cancer patients from different parts of the country, and I have yet to find a very comprehensive um, system as the one we have in California. And even though it has still a lot of room for growth and many flaws, but I really cannot think of a better state to offer cancer care than California right now. And I know some of my friends in New York might also say that they have good system, and I don't disagree. But I think that we're very fortunate here with the laws, especially like the latest one you mentioned, with being able to offer care for people regardless of their immigration status, as long as they are older than 50, and now soon enough we're
Mhm.
gonna start doing 26. I mean, I have a lot of hope for especially the young adult cancer population, that they will be able to get the care they need and not have to stress about that, because that's one of the big health gaps for AYAs.
Finding that the care, the access.
The access to care. Yes,
Mhm. Yeah. Yes, I'm optimistic as well too, but like you said, it comes with a whole nother set of obstacles where we're going to have to, make sure that, these
navigate them
folks that are
around.
new to the system know how to navigate it, right? Us that
Yes.
work in the system don't know how to navigate it
Yeah.
sometimes
If it's
and can get
difficult for
lost.
us, it's gonna be
Yeah.
more challenging for them. So
Exactly. And the whole idea, like you said, of preventive care, you mentioned that, like
yes,
preventive care is foreign because you go to the emergency room, you only go when you're sick. Why are you going to go when you're healthy?
exactly.
And most of our screenings are preventive care, and that's
Yeah.
how you do
Because
early
we want to
detection.
move the people from going to the emergency room into the maybe like the primary care offices or
Right.
clinics, like
Or
community
the idea of
clinics.
urgent care, right? Most don't
The
even know
idea
what
of
urgent
urgent
care
care,
means.
yeah.
Yeah.
Yeah, many times people get so confused with the urgent care, emergency care.
Yeah. We still got a lot of work cut out for us, but
Mhm.
luckily we have people like you willing to do it. So
Thank
we're
you.
we're lucky in that sense. And I'm going to give you one last question since we're
Sure.
coming up towards the end now. And the question is, what's the most important lesson that you've learned from immigrant communities?
I I cannot tell you how much I appreciate the openness that some patients have had when they have shared their struggles with me. Not only the struggles during the time they had to make the transition to come out of their countries to come here and after, but even to share all the things that are still important or hurting in their heart that they left behind, and how that message of I'm not giving up regardless of what I went through, because that's exactly what we see as cancer survivors too. The same parallel idea of you don't know what you had before and now you have to adapt to the new normal. That's exactly what I learned, and I appreciate the most from the immigrant patients, that I learned that every day. Um, the picture behind me actually is from my hometown in Mexico. I'm from Coatzacoalcos, Veracruz, in southern Mexico, and I had the privilege to go in December. And this is the same railroad where the beast passes by, the infamous train that where people from especially Central America pass through Mexico in their journey. Uh, it's it's a picture that I felt like I needed to have to remind me of the struggles of people, and that we're very fortunate to be where we are right now.
Mm, thank you. That's very touching. I actually assumed, and I shouldn't assumed, but I was like, I think that's what that picture is in the background, right, with the railways, because you're so familiar, with those impactful images, showing, like you said, that journey that a lot of folks, take just to for the opportunity of a better life, right, here
Mhm.
in the United States. So thank you so much, Ghecemy, for sharing that wonderful work that you've been doing in immigrant communities. We definitely appreciate that and appreciate you. And we hope that, it's moving the needle little by little, but we're getting there, right? And we hope, like you said, in California, we're a little bit more, and we're hoping the other states can also catch up so that, we
Mhm.
can impact all our immigrant communities. So I definitely want to thank you. And then I want to thank everybody here that came today for being part of the Cancer Support Community Los Angeles Health Equity Summit, Elevating Patient Narrative in Cancer Care. Again, we'd like to thank our sponsors, St. John's Health Foundation, Grow at Annenberg, Pisern Family Foundation, Walgreens, UCLA, Cedar Sinai, Insight Pharmaceuticals, Tower Cancer Research Foundation, and Anthem. We look forward to seeing you tomorrow for another full day of educational and enlightening talks. So have a great evening, and we will see you all tomorrow for day 2.